Hey guys, I had a little bit of time left after my office today because we see people until 7 on Tuesdays and it is only 6 o'clock. And my whole face is moving, so I am due for Xeomin, and I thought it would be fun if I did that with you guys. So I've got the angle set up in the mirror. Hopefully you can hear me. I've also got my 2 syringes of Xeomin. I'm going to do several areas because I'm going to do my forehead to get those little horizontal lines. I'm going to do those little 11s, the glabellar frown lines. I'm going to do the crow's feet around my eyes, and then I get these little, they're called bunny lines when you squint your nose. So I'm going to also freeze those, which is why I've got 2 syringes. And I like to use Xeomin. It's a little bit more purified than Botox. It's got fewer proteins in the mix, which means you're less likely to develop antibodies that stop it from working. It's also a little bit less expensive. And then I've got a couple alcohol wipes to clean my skin. And then the key here is the ice pack. I hold the ice pack on for a few seconds before each injection. That not only keeps it really comfortable, but it also helps decrease bruising. And then the needles I use are very special 32 gauge, which is itty bitty tiny needles, so really you hardly feel them. So I'm gonna start injecting, and if you have any questions about this, feel free to shoot me a DM. So first I'm gonna clean my skin off with some alcohol. And I always write down my plan of how much I'm injecting in each area, and I've got it on a little cheat sheet with me because otherwise I have to think too hard. So skin is all clean, and then I'm gonna hold a little ice, and I'm just seeing which syringe I got. All right, so I'm gonna do my glabellar frown lines first, and that's 3 little quick injections for me. They're not super strong, but I have been getting Botox or Xeomin since I was 28, and I turned 40 this month on the 18th, which is National Botox Day. So I figured, in light of that, I better freeze my own little lines, huh? All right. It's a little tricky seeing how much I inject, and the angle is a little weird, but I've kind of figured out how to look in the mirror and do it at the same time. All right, so that was the first one. Do a little more ice. So when people ask me if this hurts, it's obviously not too bad since I do my own. I mean, it's a little tiny pinch, but nothing big. And what a lot of people don't necessarily realize with Botox or Xeomin is that the more consistently you do it, the better your results. If you look at my forehead and my frown lines, and yes, those little bumps, that's just the medication. It will go away here. The more consistently you do your Xeomin every 3 months, those lines don't get deeper and your skin will actually remodel and they'll get shallower. So it's really important that you do it consistently. All right, now I'm gonna get my little bunny lines here. And in fact, in my office, we encourage people to schedule their next treatment in 3 months before they leave because our schedule gets booked up so fast. We don't want you to have some wrinkles and then be waiting on an appointment. So these are the little muscles in the side of your nose. They're itty bitty. But in me, they make a really strong squinchy line. That's one side. We also use Botox on the lower part of the face around the mouth, but in much smaller amounts because we don't want to cause problems with speaking or eating, drooling, not cool. If you've seen Christmas with the Cranks, there's that scene where Tim Allen is drooling all over, and that could happen if you got too much Botox, but we just do a tiny amount. So areas I use Botox or Xeomin in the lower face, I will do it in the upper lip if somebody's got kind of a gummy smile, or if they've got real strong frown muscles that make their chin look bumpy and rough, then we'll do it there. Or sometimes if you want a lip flip, you can do a little bit of Botox in the upper lip, and that will just give a little more fullness without doing filler. All right, so I've got 2 of my areas done. Next, I've got my forehead, which is just 3 tiny injections. I don't have very strong forehead lines. And it's interesting because the wrinkles people get just depends on how their muscles are made. And some people have super strong muscles and other people don't. So it just completely depends on basically how you're built. Some people have really high foreheads with lots of wrinkles, and some people have lower foreheads and just a couple wrinkles. So it very much just depends. And that's why we don't give prices over the phone. We can give you kind of an estimate of what you might need. But until we see you in person, it's hard to know exactly. The interesting thing is when you inject over your forehead, you hear a little crunch, even though it's not hitting the bone. One of those weird mysteries of life. All right, forehead's done, so now I'm gonna do around my eyes where those crow's feet are. The interesting thing about doing around your eyes is you'll find that you can't smile, like when you smile really big, you can't squint. So your smile still looks natural, you're still smiling with your eyes, but if you're out in the sun, you better have some sunglasses. And that's how I usually know my Botox is kicked in. Or my Xeomin, I use those words interchangeable. Kind of like how Xerox means to copy something and Kleenex is facial tissue and they're all the same. Okay, so you can see a tiny bit of oozing, but not bad. I haven't taken any aspirin, Aleve, or ibuprofen, or naproxen in the last week, and that definitely helps decrease bruising, so we recommend that. You certainly can get treated if you've taken those, but you're more likely to bruise. And in fact, I have a couple patients on blood thinners, and we still treat them and they do okay. You've just got to understand that you're at a higher risk of bruising. All right, so I just have this last side. All right, so that is all done. I usually like to ice for a minute or two just to decrease the risk of any bruising. And this will take about 5 to 7 days to kick in. So it's not immediate, it does take a little time. If you find after a week that things aren't perfectly symmetric or there's still a little motion, then sometimes people will get a touch-up. Usually by the time we've done your treatment a couple of times, we've got it nailed down in your routine, and then you just pop in, we do it, and you're out in 10 minutes. Very cool. If you have any questions about neurotoxins, shoot me a DM. They are fantastic. And also be aware, National Botox Day is November 18th and 19th. Allergan is going to be offering a promo where you can buy a $50 gift card and get a $50 gift card free. And we're going to be doing a promo where you can buy 30 units of Botox for the price of 40, since I'm turning 40. And you can stack those. So we've got a special office day open on November 19th. Just so we can get some more people in, and Val and I will both be here. We hope to see you then.